Assalamu alaikum. I am Dr. Majid Al-Aboud. I am a consultant endocrinologist. Today I will talk about writing a paper for publication. So let's start with this question. What type of paper? We have many types of paper, and this is called the hierarchy of evidence. So as you can see, the hierarchy of evidence starts from the top of the hierarchy are the systematic review of randomized controlled trial and meta-analysis, followed by randomized controlled trial and cohort study. And the least evidence is taken from the base of the hierarchy, that is the expert opinion, because with the expert opinion, there are more bias than the randomized controlled trials. So what types of papers can we publish? There are many types of papers. We have meta-analysis, and we have systematic review. We have narrative review, and I will talk about the difference between these three things. We have original research, we have case reports, and we have case series, and finally, we have editorial or letter to the editor. So how is systematic review is different from meta-analysis and different from literature review? A systematic review addresses a focused clinical question in a structured, reproducible manner. It is often, but not always, accompanied by a meta-analysis. Systematic review, when you want to study certain subject, for example, the effect of aspirin on people with diabetes. So what you do in order to conduct a systematic review, you search the literature for all the papers about this subject, and then you choose, according to systematic point, the best articles about this subject, and you reach a conclusion from the total of these articles. While a meta-analysis is a statistical pooling or aggregation of results from different studies, providing a single estimate or effect. Meta-analysis has different concept than systematic review. An extra thing is when you pool the data from all these studies, putting them together, and you have a big number of people included, and then you do a statistical analysis on these results. So systematic reviews are qualitative, while a meta-analysis are quantitative. While a literature review is something similar to the systematic review, but it is less complicated, such as when you are writing a chapter for a book. So you read from different resources, and you collect the data from these resources and present them in the form of a literature review. Literature review does not necessarily mean it is absent from bias, because sometimes it might reflect some opinion of the person who wrote the literature review. What are the types of clinical questions? In general, we have two types of clinical questions. We have background question and foreground question. So the background question is a question for general knowledge about an illness, disease, or condition process. For example, what are the clinical manifestations of a stroke? Or what are the causes of a frozen shoulder? Here, to answer this question, what we need to do is to look at the resources, usually the textbooks. Textbooks can answer such a question. On the other hand, there is what is called foreground question. And this is a question that we see in our life. So the foreground question is that type of a question that we see during our daily practice. For example, we are facing a difficult case and we don't know the answer for that case. We don't know how to diagnose it or how to manage it. In that case, this is called a foreground question. And to answer this type of a question, for example, in patients undergoing endovascular treatment for paraclinoid aneurysms, what is the risk of postoperative visual impairment? Here, we should look for the resources, usually the databases, such as Medline, Embase, Cochrane, Library, Scopus, and PubMed, etc. A very important question whenever you want to conduct a study is the concept of pico. So asking a clinical question can be summarized by these 4 letters. P stands for the population or patient, I stands for the intervention, C for the comparison, and O for the outcome. For example, P are the group of people that you want to study them. If we have such a question, which is the effect of aspirin or the effect of black seeds on control of blood sugar among people with diabetes. Here the P is the patients with diabetes. The I, the intervention, is giving them black seeds. The C is the comparator, usually the control or healthy group. In such case are those without diabetes. And the O is the outcome. And the outcome here is the control of blood sugar. Whenever you know this concept, everything will be very easy for you. So before starting conducting your research or a study, put in your mind the pico and try to conceptualize your idea according to these letters, P-I-C-O. Sometimes we might add picot. T may be for the time or the type of study, etc. Not all research questions are about interventions. There are many types of questions. For example, what causes the problem? And clearly this is an etiology question. And what is the frequency of the problem? And this is a frequency or epidemiology question. What does this person have the problem? This is a diagnosis problem question. And what will get the problem? Who will get the problem? And this is a prognosis question. Why this is important? Because according to the type of the question, you will design your study. This table shows you the perfect design of the study according to the type of a question that you have. For example, for therapy question, it is better to conduct a randomized control trials and then cohort and then case control studies and then case series. While for a diagnosis question, it's better to do a prospective study than blind comparison to a gold standard or cross-sectional. In the etiology type of a question, it is better to do a randomized control trial. In a prognosis question, it is better to do a cohort study. While in a prevention question, RCT is the best. In a clinical exam, the best is prospective studies. While when you are questioning a cost question, then economic analysis would be perfect. Now let's talk about the preparation of your manuscript. So before you start your study or paper, read widely. Try to read a lot of literature that is related to your subject. Second, focus your area of interest as you go. And then organize your ideas and mind map spreadsheet. I'm going to show you what is the meaning of a mind map. And then develop a framework for writing. Put timelines for your writing in order not to waste time. And consult with your colleagues. It's very important to take opinion of colleagues and supervisors. They will make your study more robust. And organize your sources by using, for example, a specific program for referencing, such as the EndNote or the Mendeley. And this is a map that is called a brain map that will make the conduction or preparation of your paper easier. And it's very important to follow the checklist. And we have many checklists that are freely available. For each type of article, there is a checklist. For example, this is the consort checklist for randomized controlled trials. As you can see, it starts with the title and the abstract, and then the introduction, the methods, and etc. It will give you a perfect description of each step. If you follow these steps, definitely you will end up with a robust study. Now let's talk about databases. We have many databases. in order to answer the foreground question that we talked about, or to conduct a study, you have to search the literature and you have to set the database. We have the Scopus, we have PubMed, we have Medline, we have Ovid, and we have Cochrane, and finally we have the Google Scholar, which is a general. Let's talk now about each part of the article. Let's start with the abstract. The abstract usually is a summary of your paper. It is either structured in the form of background, methodology, results, and conclusion, or sometimes unstructured. It depends on the instructions for authors. Therefore, it is very important to read the instructions for authors in the journal. Some journal, they don't accept abstract that have more than 250 words, for example. Then we have the introduction. And in the introduction, you should clearly state your question, and you should discuss the existing state of knowledge, what has been done in the past by others, and what trends are developing for the future, and what are the controversies that you are looking for, and what prompted you to ask this question. It is very important to know a gap in the knowledge and to diagnose that gap and to try to fill it in your introduction. The methods. The methodology, it should clarify how and why a study was done in a particular way. And do not confuse with the results. Include information that was available during the planning period before starting your study. While anything that happens after the study, this should belong to the results section, not in the methodology. And in the methodology, you should write in details what you have done and what types of tests that you used and what type of instruments and what are the endpoints that you are looking for. A very important thing is the flow chart. On your right-hand side of the screen, you can see a perfectly written flow chart. And the flow chart, it describes clearly the steps of your methodology, starting with the recruitment, then the exclusion, and you end up with the final number of people recruited in your study. Body of the text is important. In the body of the text of your article, you should organize the evidence in a chronological way. So with the time, there are thematic organization, we have methodological organization, and we should start generalized and then be specific. And there always should be connection of ideas. Try to connect ideas together, putting them together that occur across different sources, which is called synthesis of ideas. Evaluation of your sources, looking for the strengths of each study that you mention in your introduction and weaknesses, and try to criticize these by what is called the critical appraisal. Let's talk about the results section. In the results section, we have a primary endpoint and we have secondary endpoints. By primary endpoints, for example, is the major endpoint, for example, all-cause mortality. While the secondary endpoints, for example, we have, although beta blockers reduce all-cause mortality, they also increase hypotension and stroke. Here, hypotension and stroke are considered as secondary endpoints, while the primary endpoint was the all-cause mortality. In the conclusion section, you will summarize what you have done and the result that you reached. So you conclude your result in a few sentences. So it is a summary of the main result. Always refer the conclusion to the original question. How does the evidence presented change the way we think about it? And relate the closing thoughts to the wider implications of your findings. So in the conclusion section, we should emphasize the end point that we are looking for, and also at the end give recommendations for future studies. References, as I said, you have to use one of the referencing programs or software such as Mendeley or EndNote. This will make life easier for you as a researcher or author. And check instructions to authors, because for each journal there are a specific reference style that should be followed. Also, some famous journals have their own references style in the software. For example, in the EndNote, just write the name of that journal and the references will be accomplished automatically. And always do not forget to check after the software, because these softwares often make mistakes. Here are recommendations when you want to write a bad paper. Please do not follow these. First, when you exclude pivotal studies, or emphasize outdated materials and ideas, or when you avoid discriminating between relevant and irrelevant materials, or when you are summarizing each paper one by one, or when you fail to develop links between ideas, and avoiding giving some direction or opinion on paraphrasing others, or when you fail to use academic language, or the length of your article is too short or too long, or when you use point, form, and acronyms without explanation. These are the points that will make your article very bad. Please do not follow these. A very important step after completing your study and preparing your paper is to submit your paper to the journal. And the most important thing is to choose the journal, because the choice of the journal will make your paper more likely to be accepted for publication or not. There are 4 main factors that affect the choice of the best journal that is suitable for your article. First of all is the relevance. And in the relevance, we mean the journal scope is relevant to your subject. So please do not submit an article about, for example, diabetic food in a journal about, for example, psychiatry. Second is the reputation. Reputation of the journal is very important. Now there are many predator journals, and there are very reputable journals on the other hand. The reputable journal, usually the journal with the highest impact factor, the journals that have the best readability, and publishing in these journals will make sure that your article will be cited many, many times in the future. The third point is the visibility. There are 2 types of journals. We have open access journal and subscription access journal. The open access journal, they are open to all people. So there are no fees on downloading the article, the full text article. These are more readable usually than the subscription journal that requires subscription and paying money for getting the full text article. And fourth is the validity. Now we are living in the era of many predator journals. These journals try to tempt you to publish your work in this journal, and they are fake journals. They are not indexed in the famous indexing system like Scopus or other systems. So avoid these journals. How do you know these journals? This is the type of journals that always sending emails to you saying, please publish your article in our journal. And also they insist always on paying money for publishing the article. So please avoid these predator journals and always check the database for the reputable journals. In order to know the predator journal, there are many tools. For example, we have the OREX, we have the Scimago journal ranking, and we have the Scopus. At the end, I hope you enjoyed my presentation and you get benefit from what I presented about how to prepare your paper and how to publish it. And thank you.